Hey everyone, it's Shelley Prosco. I am really happy to announce that I have another series for you all. This one is self-compassion in pain care. It's a topic that is near and dear to my heart. So this is for you, those of you that live with some sort of chronic pain or persisting pain, and also for professionals if you work with people in pain. This is a 4-part series and we mostly practice. The first class does have some lectures, so I have a PowerPoint, but it's important. You know, I talk about self-compassion, the 3 components, and the common misconceptions around self-compassion, and then also what the research is telling us about the benefits of self-compassion, just in general, for us as human beings, or how our physiology can change, and also within the context of chronic pain. So there's a lot of research that we have now around self-compassion practices and your pain. So I'll talk about that in the first class, and then I still offer some practices and I guide you through some practices in the first class. But then the remaining 3 classes, it's all practice. So I guide you through movement, breathing practices, through certain meditative type mindfulness practices, all with the theme of self-compassion. And you'll see that through the language I use and through the specific practices that I choose. And the participants who joined live in this, really, the feedback that I got was that they really appreciated just some time for themselves in a safe environment where you are guided in a compassionate way, and you can learn what does that even mean to be guided in a compassionate way. And some of that too, we explore your edge and see if you can muster up some courage as well to explore your edge. And again, doing that in a compassionate way. So whether you're someone who works with people in pain, or you do have pain, or maybe you just want to move and take some time for yourself. And the great feature of this is that you get to download these onto your device, and so then you get to keep them. So you have lifetime access to them. And please do keep in mind that this class series is not intended to act as an assessment or to act as any kind of treatment or medical advice. So please, as always with anything, please consult with your own licensed healthcare provider and get medical clearance before participating in these, like you would with any kind of exercise or meditative type program. Okay, so all you need is a little place to stand. You don't need much space, just move around a little bit, a place to lie down, maybe get some pillows, blankets, anything you might need for comfort, and a chair. And I will guide you, no worries. I will guide you every movement, every practice we do. I'll give you options. If you don't want to sit, you can lie down. If you don't want to lie down, you can stand. So no worries there. It really is for any level. And even if there are some adaptations or some options that I'm giving you that don't seem to work, I always give the option to visualize or do your own thing. So you'll see. Okay. Hope to see you there. Although this series may be very beneficial and useful for you in some way in your pain care, this series is not intended to assess, treat, or act as medical advice. It is not meant for those looking for treatment for chronic pain or any other physical or psychological health concerns or conditions. Please receive medical clearance prior to participating, and always follow the advice and guidance of your own healthcare professional.